This is 10 minutes.
I have said many, many times, every member of the Democratic caucus has expressed to me and to all of our leaders, and of course Mr. Clyburn, our whip, counts them, so he hears from them most directly. All of them want to vote for health care reform. We believe that we are going to pass a very good health care reform bill. Last night, we made very significant progress. Mr. Javier Becerra, the vice chairman of our Democratic caucus and a member of the Ways and Means Committee, moderated and at times refereed, at times cajoled, but at all times elicited the opinions of members on the very critical issue of Medicare reimbursement rates. There were regional differences. Members have been very concerned and very animated about that, and there have been real differences, as you would expect in an issue of this magnitude. And I'm very pleased to report to you that last night they reached consensus. This morning they met with the leadership. We went over the language, and Mr. Becerra indicates that we have full agreement on that issue. And I want to congratulate Mr. Becerra on that very, very significant step forward in the process of reaching consensus. We are continuing to work towards consensus. We believe that the Energy and Commerce will continue its work in the regular order. We are looking forward to marking up the bill in Energy and Commerce. And that will proceed next week. We are absolutely committed to passing a health care reform bill, and we are energized by the progress we made last night and the progress that we are making today. The leadership is committed to that end. I believe our members are committed to that end, and we have every intention of passing a health care reform bill and sending it to President Obama for his signature by the fall.
Leader Hoyer,
yes.
On the floor an hour or so ago, you had expressed some doubt as to whether this can happen next week. Can you elaborate on that? And also, on one of the comments you just made, will you require that this bill get out of Energy and Commerce, or will you reserve the option of bypassing?
We expect the committee to be able to work its will. That is the Speaker's expectations, my expectation, the hope of our leadership, and more than hope, our expectation. So that we are looking forward to the Energy and Commerce doing its work and reporting a bill. What I said on the floor in the colloquy to which you refer is that I had pledged and the Speaker had pledged to give sufficient time for members to review the product of the committee and the product of the Rules Committee. What I said on the floor was because the committee process has taken longer than originally anticipated. As I said, we made real progress last night. These are difficult issues, but the members are committed to working on them. That it would be difficult to meet the time requirements by this coming Friday. So I do not believe that we'll be able to meet those time constraints by this Friday. I said that we might be meeting on Saturday and maybe the 3rd or the 4th. We will see how we progress. But I will tell you this, whatever we do, we intend to keep working on this very hard between now and when we come back. We expect the bill to pass out of committee. As you know, we have 3 bills. The Ways and Means Committee, of which 3 of the leaders are members, and the Energy and the Education and Labor Committee have reported out bills. Energy and Commerce Committee will be the 3rd leg of that stool. Then they need to be put together, and we will certainly be working on that, we expect, as we move forward.
Mr. Leader, if I could just clarify, do you agree with Congressman Clyburn that you should delay recess if it's not passed? In other words, are you committed to passing this bill out of the House before you go off to August recess?
Congressman Clyburn, the whip, can obviously speak for himself. But we've met in the leadership, and I think what we want to see happen is, and we think we're making progress. I want to stress how optimistic we are and how encouraged we are by the fact that we had such progress last night. Obviously, in consideration of a bill of this magnitude, you have different opinions, and from time to time, you have opinions that differ pretty substantially, and you hear about it and you write about it. But we are making progress. Had a great victory last night and this morning, for which I congratulate not only Mr. Becerra, but all of the people who worked on that. It is my expectation that we will continue to move forward. I've been in discussions with the White House. They want to see us make progress, and they, I'm sure, will be with us when we have a committee product out of the three committees to then work with us and bring those bills together. That may take some time, and so, as I said, we may be working on that through the August break.
Mr. Leader, do you think that the tension that stirred up among the Blue Dogs and things, that has become so inflamed over the past week that makes it harder actually to come through? I know you're very optimistic here, but still it seems like that has become white hot.
Well, as you know, I'm pretty close to the Blue Dogs, and I'm pretty close to Henry Waxman. Henry Waxman I've known for 45 years, and I've known a lot of the Blue Dogs, and they're close friends of mine. You know, in the course of legislative process, you know, there's sometimes people get animated about their positions, and you would expect that. These are very important issues. This is a critical bill for the American public. We're absolutely committed to passing a bill which will give affordable quality health care to every American and make sure that every American has access to that care. I am confident that the Blue Dogs, who have all told me they want to vote for a health care reform bill. Now, they have certain opinions as to what that bill ought to look like. Mr. Waxman clearly wants a health reform bill, so I'm confident in that context, with everybody wanting to accomplish the objective, that we can do that.
Mr. Hoyer, thank you very much. Just to clarify, Mr. Hoyer, I know you're confident, and you were just talking about the Blue Dogs, but Mike Ross said that he didn't see how we could do anything, that things had broken down, and this whole thing, when you were up here and you talked about the agreement and that was supposed to help with the Blue Dog negotiations, well, obviously none of that happened.
Well, let me first of all say that Mr. Becerra is to be congratulated. Why is Mr. Becerra to be congratulated? Number one, he does an excellent job as a member of Congress and as our vice chair of the caucus, as well, because there were very strong feelings in that room, believe me, and you saw those expressed to you from time to time in terms of very strong feelings about the rates of that Medicare paid and the regional discrepancies that existed. Very strong feelings, animated feelings, and they were resolved. So I am confident that based upon that, we can resolve these other differences and bring us to a position where we have a bill out of committee and three bills ready to be put together and brought to the floor. I want to also say that I think your premise is incorrect. I think Mr. Becerra would say that as well. I think the agreement that was reached by Mr. Becerra is helpful to the Blue Dogs. Now, was it what they were seeking per se? No, they have other issues that they're interested in as well. But I think Mr. Becerra's work and the agreement that was reached certainly is of help, and I think the Blue Dogs felt was a positive step. It was not the step for them, but a positive step.
Thank you. Thank you.
Are you saying that you'll work until the bill is done?